Hello, everyone, and welcome to Crushing PCOS, an integrative and natural approach to resolving polycystic ovarian syndrome and reversing those things. So, the first video I talked to you about my story and how I was handling my polycystic ovarian syndrome and what all I went through. So, I'm sure many of you could relate to that. Today's episode is about talking about the different types of polycystic ovarian syndrome. So many people think that that polycystic ovarian syndrome is just limited to the ovaries, and it's limited to having things that are connected with the ovaries, and it has nothing to do from that it has nothing to do with other hormones, which is really not correct, because uh, it could be also from other hormones like thyroid, and it can be from thyroid, it can be from uh, cortisol. So it can be from these two hormones too. And I'm just trying to you know uh, remove my notifications so that it doesn't disturb us. Yeah, so I was saying that polycystic ovarian syndrome is a very complex constellation of symptoms where you can have menstrual irregularities, you can have hair growth in unwanted places, you can also develop fatigue, brain fog, infertility, prediabetes, diabetes, and you're more prone to developing cancers because of the hormone imbalances, because of estrogen dominance and insulin resistance. So uh, the major hormones actually that play are insulin and cortisol, and then your thyroid, and then your sex hormones. But there is another condition called Stein-Leventhal syndrome, in which there are a lot of cyst formation, and that is connected from your pituitary and hypothalamus. The gonadotropin releasing hormones, they are not released in a cyclical way, pulsatile way, but it is irregular, so that's why you develop cysts. So uh, when your hypothalamus pituitary, it secretes the gonadotropin releasing hormone, then it secretes the luteinizing follicle stimulating hormones, which act on your ovaries to produce, to mature your uh, follicles into ovum. And then estrogen and progesterone are released in a cyclical manner, and then you have your ovulation. But that doesn't take place in that in that fashion, and there is a disruption. So uh, the LH FSH is not secreted how it should be. So the ovaries get stimulated to produce a follicle, and then the levels drop, and then of FSH and LH drop, and then so the it's never really developed, and so you develop multiple follicles which don't mature, so there is no ovulation. So it's mostly anovulatory. But you can also have polycystic ovarian syndrome without any cyst formation. So that's why I said it's very complex, and it's sometimes very difficult to understand, and sometimes difficult to treat if you don't know, if you don't take all the hormones into consideration. So with the thyroid, or with the cortisol is a stress hormone. It can suppress your hypothalamus pituitary to produce those hormones, so you may not have cyst formation. When your thyroid is similar, it's a major metabolic hormone, and that's why people with PCOS are sometimes prone to developing hypothyroidism, which is very common. So when you are looking at polycystic ovarian syndrome, you just cannot take into consideration estrogen or progesterone only. You have to take into consideration all these hormones to get a better outcome. That being said, it is a metabolic syndrome. It is also considered to be an autoimmune condition, which was not recognized previously. So in the conventional method, there is a way of looking at polycystic ovarian syndrome and treating, but in our functional medicine or the root cause approach, we look at it differently and we address it differently. So, in my next episode, I'm going to talk to you about how we differ from conventional way of looking at polycystic ovarian syndrome compared to the functional approach or the natural approach of looking at the polycystic ovarian syndrome. And that being said, I'll also tell you that many of these hormones, when they are not balanced, they produce psychological symptoms, and that's why you can get stress. You're unable to cope with stress, anxiety, depression, and also body shaming, because you don't feel like looking at yourself in the mirror. You don't feel like, you know going out in public sometimes, and you're always conscious. You always, feel that there is something wrong with your body. So all that is due to the hormonal imbalance or the chaotic action of these hormones. So take care. I hope you if this was informative. Please leave a comment. If you have any questions, feel free to leave a question. I'll make sure that I answer those questions. And I'll talk to you again soon about in another episode where I'll discuss the conventional versus the functional medicine approach to polycystic ovarian syndrome. So bye now.